it's still October, still Breast Cancer Awareness Month. So now the weather has changed quite a bit, and we have more of the Halloween-like atmosphere, the fall weather, as opposed to the prolonged summer that we were having earlier this month. With Breast Cancer Awareness Month, there were a couple of things I wanted to talk about today. The first is that I feel like my feelings about this month are pretty lukewarm. I've seen a lot of survivors who feel very strongly against this month. They think that there's just some of the advertisements about the month, like some companies will just use it to their advantage. They'll donate 1 cent from like the sale of like a $30 pink t-shirt to actually helping cancer awareness, and then say they're helping, with that 1 penny, while they're still making a bunch of profits off of survivors, basically. So there's that, and there's just a lot of negative feelings about maybe bringing up bad experiences, which makes a lot of sense. A lot of survivors have PTSD, so we don't want to necessarily dwell on some of these issues. But there are a lot on the other side who also are advocates for breast cancer awareness. They maybe have a lot of pink ribbons around, and they're sponsoring races and fundraisers and just doing a lot. And I think I fall somewhere in the middle, at least right now, during doing my second October as the breast cancer survivor. I do think there's a lot of good causes that should be supported, and this month might be a great time to do it. Support Mediviver, which helps metastatic breast cancer research, which they're the ones that need the research. They're stage 4, the only non-curable stage of breast cancer, so it should really be funding given to that stage to help those people. And there's other programs too. I think there's some hospitals perhaps to donate to, other research programs. Just make sure whenever you're donating that it's going to the actual cause, if you are interested in donating, and then it's not just going to some company that is pink painting everything for the month. And I think there is also importance in raising awareness of breast cancer, just because I think sometimes it's stigmatized and we don't necessarily feel comfortable saying breast or breast cancer out loud, or people may feel uncomfortable talking about their bodies because breasts are sexualized. Surprise, you guys already know that, right? So we feel like uncomfortable talking about this sometimes, and it shouldn't be that way. We also should take away a lot of the sexuality that is brought into this month. Like there's like the campaigns like Save the Breasts or Save the Boobs, whatever they say. Different words for that, when a lot of us survivors, we don't even have boobs. So like, shut up about that. We really need to focus on saving the person and not some fat attached to the front of our bodies. But there's just like this, I feel like there's just like some kind of disconnect there and that stigma. So let's try to remove that and just try to focus on how can we make people aware, how can people get to know their bodies and be aware, and talk to your doctors when you notice something odd or different. And I feel like this is especially important for young women like myself. Feel comfortable with your doctor, because I know I've been through some doctors where I just didn't feel comfortable talking about things that I thought were too personal or too embarrassing, and I wouldn't be honest with that doctor because I felt too embarrassed or too shy. And I have an amazing doctor that I've had for a few years now, and so I'm so glad I knew her at that time, and I felt open to talking with her about pretty much anything. So that was good that I was able to talk to her about the lump I noticed, and that she went forward and helped me to get the biopsy. So there's that. I think just that seems especially true for just younger people, perhaps, and maybe feeling more reserved or shy around your doctors. Just find a doctor you trust and can talk to about anything. You don't have to give them a whole overshare, but just feel comfortable talking to them about that more personal stuff. And then secondly, about this month is I'm realizing survivors all have a different way of being survivors, of dealing with this experience. I've seen some survivors who just seem to turn off completely after treatment. They don't go to their appointments, they don't check in, they just kind of ignore it all as if it never happened to them. And I know there's some others that turn towards more advocacy and they're more involved. And there's lots of different ways to deal with this. I definitely have my days where I'm more focused on cancer and how can I be a better person because I've gone through this experience, because I'm living on borrowed time now, basically. So I should do something good with that time, is what my mind tells me and what my heart tells me. But I also need to find a balance that's healthy for me now to be careful of my body, to not overwhelm myself and not take on too much. So there is that balance that I'm more aware of now, and I'm more cautious with my time and what I choose to do. And so hopefully survivors out there are finding a good balance this month and staying healthy and staying happy.